And the first speaker we have today is Dr. Shishir Verghese, who will be presenting real-world outcomes of past plana vitrectomy with glueless, sutureless SF.
We'll start. Yeah. So good morning, everybody, and thank you, KSOS, for this opportunity to for presenting. So I'll be talking on real-world outcomes of past plana vitrectomy with glueless, sutureless, scleral fixated intraocular lenses. So no conflict of interest. So just a brief introduction. So visual rehabilitation in AFK is a unique surgical challenge, and especially in the absence of a capsular support. So SFILs are ideal because it's placed closer to the nodal point of the eye and a greater distance from the cornea. And many techniques of SFIL has been described previously. So what is the aim of our study? To report the outcomes of pars plana vitrectomy with sutureless intrascleral fixation of three-piece IOL in the ciliary sulcus in patients with aphakia of various etiology. So it was a prospective study. 54 eyes were initially included, but only 40 eyes satisfied the inclusion criteria. And it was conducted in a secondary eye hospital from a period of 2022 April to March 2023. And the procedure was PPV with sutureless SFIL, either as a primary surgery or in combination with lens nucleus or IOL removal done by a single surgeon. And data was analyzed following the data collection. So inclusion, simple patients with aphakia more than 18 years of age, follow-up of more than 6 months. That was one of the main thing to include the patients in the study, and horizontal corneal diameter should be 11 or less because otherwise the SFIL won't fix. And corneal pathologies are excluded: scleral thinning, uveitis, scleritis, advanced glaucoma, or even gross retinal pathologies or macular pathologies were excluded. So ocular examination before the surgery, vision, slit lamp exam, tonometry, dilated fundus exam, and biometry was done. And this was the surgical procedure. So superior small conjunctival peritomy, yeah, followed by marking the scleral tunnels and with the crescent just making a pocket using the 1.5 millimeter keratome. So two Gabor pockets are created. Then all the three ports are put. SICS tunnel is made superiorly, and then a complete vitrectomy is done. Not just an anterior vitrectomy, but a complete pars plana vitrectomy. No PVD induction. 360 degrees of endo laser is also done. Periphery is checked properly, and then only the IOL is inserted. So using the max grip forceps 25 gauge, one part of the haptic is held and externalized through the scleral tunnel, and then the other haptic is also externalized. Yeah, so other haptic is also externalized by just directly putting it in the vitreous cavity and removing it from the other side of the scleral tunnel using the same max grip. So no two instruments required, only one. You can do in some cases where the pupil was small, we did the same thing with a needle, and you can see a well-centered SFIL at the end of surgery. So no glue also used. Conjunctiva was sutured with Vicryl if required, and all ports removed and no suture. So this was the procedure followed. So the follow-up post-op day 1, post-op day 15, 1 month, 3 month, and 6 months. But the data we have analyzed for day 1, 1 month, and at 6 months. So coming to the basic demographic data, the average age was 68.5 years, 71% were males and 28.2 were females. And blunt trauma was seen in, mild blunt trauma was seen in 9 cases, that is around 23%. So 45% were surgical aphakia, dislocated IOL were seen in 27.5, and dislocated lens was seen in 17.5, and nucleus drop or dislocated nucleus in 10% of patients. So procedure performed: PPV with SFIL 45%, PPV with nucleus lens removal 27%, and IOL removal again 27%. So at 1 month follow-up, the mean uncorrected visual acuity improved significantly, and also there was improvement in the mean best corrected visual acuity. And at 6 months also, between the pre-op and the post-op, there was significant visual acuity improvement, but no difference between the 1 month and the 6 month. So no significant difference between post-op BCV at 1 and 6 months. So, and also there was no significant difference between the pre-op BCVA and post-op uncorrected visual acuity, just that we were just helping them get rid of their aphakia glasses. And coming to the sub-analysis of the BCVA also, you can see the significant improvement in the surgical aphakia group, the dislocated nucleus, dislocated lens, and the dislocated IOL group. And we also just analyzed the refraction sphere and cylinder. Post-operative sphere we saw in two patients who had minus 0.5 and minus 0.75 sphere, but otherwise no sphere. And pre-op cylinder was 1.42, which was measured with a keratometer. And then post-op at 6 months also we measured, and it was average was minus 0.5 cylinder at 6 months. So pre-op IOP was 15.87, post-op day 1 was 9, which was, there was a significant difference. And again, post-op at 6 months was only 13.92. So coming to the complications, at post-op day 1, the most common complication encountered was dispersed vitreous cavity hemorrhage. At post-op day 1, it was also hypotony seen in 2 patients. And at post-op 1 month, 1 patient had a recurrent cystoid macular edema, and 1 patient had post-operative uveitis, which was all managed medically. So coming to the review of literature, if you see eyes, retrospective studies have only been done where PPV has been combined with SFIOL, and with varying amount of follow-up, some for 1 year, some for 1 month, and some for 7 months. And you may ask why you are combining PPV. The reason is this: in eyes with SFIL, high chance to develop RD. So 22% of eyes in this study developed retinal detachment. And once you develop an RD, it's very difficult to manage those patients, and there even surgical failure even after the retina is attached, the vision won't improve that significantly. So there are multiple studies where at least in almost all the studies there is had a retinal detachment in most of the studies. So what are the limitations of the study? Our limitation was no comparison group.
Time is over.
Time's up. Okay.
So you did show us one reference of 1000
Yeah.
of 1100 eyes,
Yeah.
but that's also with pars plana vitrectomy, right?
No, that is with everything.
So in this study, you
Yeah.
had 22 eyes out of 1300,
Yeah.
which is about 0.2%, 2%.
Yeah. But still, I mean, in those eyes, it was all, they didn't take how we have taken in a
No,
prospective.
no,
They
I
taken all
understand. I understand.
trauma, all those
So
eyes
when you're
also.
saying that in your series there were no retinal detachments,
Yeah.
do you think you have the numbers to actually compare it with, given that the RD rates are
Yeah.
so low?
No, but that is just that's a retrospective of a period of large year. But if you look at these other studies, all the numbers are low. But even in those low numbers, you are having some amount of detachments. So there's eyes with 64 eyes, where 10 retinal detachments are there. In, I mean, different techniques of
So
SFILs.
do you think that your row of laser
Yeah, I
also?
definitely feel yes. Not just laser, but checking the retinal periphery also.
In literature, what is the longest period
Which one?
for follow-up?
The literature
Yours
longest
is
period
six
was,
months,
yeah,
right?
minus 6 months. Only one study has done till 1 year, and most of the studies are all retrospective studies where the follow-up has been erratic. It's always between a period of 3 months to 6 months, because most of these patients, once their vision improves, they get lost to follow-up. Even we have done a study with 250 eyes, but the follow-up is only 3 months, because beyond that, most of the patients they lose to follow-up. Thank you.